Just a few weeks ago, more than 1,000 workers at the General Motors plant in Kokomo were producing electronics like semiconductors, engine and transmission modules for multiple industries. Today, many of those same workers preparing to manufacture ventilators to help critically ill patients suffering from COVID-19. Business of Health reporter Kylie Veleta joins us now with more on GM's role and how Trine University is also joining in the fight. Kylie.
That's right, Gary. GM is partnering with Ventec Life Systems to produce the ventilators. They hope to start rolling those out about mid-April, which is impressive considering the plan was put into place less than a month ago. And one of the main priorities is to keep the workers safe. So protocols have been created. Employees have to have their temperature checked before they reach their workstations. They'll wear medical-grade protective masks and work 6 feet apart. Intensive training is underway as workers are getting used to the medical equipment. GM says once production starts, they expect to roll out 10,000 ventilators each month. Early hires have also been undergoing intensive training and exposure to the medical equipment, many of them doing so with a sense of pride, patriotism, and duty.
It feels really good. I mean, it's good that we're here. It's sad that we're in the situation we are in, but it feels really good that we can make a difference. My company's willing to take the chance and make a difference, starting with absolutely nothing, making it into a product that we know is going to save lives.
I'm proud to be part of this team. A lot of energy here. We're all with one single motto. We have to save lives. Let's get those ventilators out there. Let's save people of this country.
It's kind of overwhelming, and it's kind of really grateful that I get a chance to do my part and be a part of something. Our modern day Rosie the Riveters.
So like so many others throughout Indiana, GM workers in Kokomo are really taking a wartime approach in this battle against COVID-19.
That's a great story, getting national headlines as well, and so many people really pitching in. As I understand it, Trine University in Northeast Indiana also joining in the fight.
That's right, Gary. Teams of staff and faculty at Trine are working with Parkview Health in Fort Wayne to develop devices that could be alternatives to equipment that's in limited supply right now, like ventilators and N95 respirator masks. One team has already developed a machine that can automatically pump a manual resuscitator, serving as a ventilator if needed. They're already available for emergency response teams and hospitals. The other item they're working on at Trine is a hard-shelled mask that could be sterilized with a replaceable respirator filter, which would increase its lifespan. And Trine's team is investigating alternative filter material that could be used in those masks, which will be tested in a wind tunnel. So Hoosier ingenuity hard at work right now. Back to you.
All right, Kylie, thanks very much. Great perspective as always, and we'll see you a little bit later in the show.